In an exclusive interview with WION, World Health Organization's chief scientist, Dr. Soumya Swaminathan, explained the nuances of the spread of coronavirus. She also busted many myths that have been circulating about the cure and prevention. Listen in.
Well, the advice remains the same as we've mentioned, and that is basically around being able to identify potentially infected people, being able to test them quickly, isolate, identify contacts, keep them under surveillance, and basically track very well the movement of these people so that you're able to identify all the potentially exposed and infected people. At the same time, I think the public at large needs to be given advice on what are the simple personal hygiene measures that people should take, which will protect them against this virus, but also against things like influenza. I mean, hand washing in general is a very good practice. Staying at home if you have a cough and cold, making sure that when you're coughing, that you have your nose and mouth covered, and wear a mask if you have to go out. But again, wear a mask only if you have a cough and cold, or if you're a care provider for somebody who is sick. It really doesn't help for the entire public to go around wearing masks. It's only going to lead to shortages for those who need them. So I think reinforcing the messages for the common people, again, calming them, stopping the panic, saying this is yet another viral infection. More than 80% of people who get this are going to be cured. They'll have a mild illness, and then they should be fine. And it's the small minority of people who may progress and are likely to get sick that we need to be prepared for. And that's where the hospitals and the healthcare providers need to be trained and make sure that there's enough equipment, including oxygen, pulse oximeters, so that you can quickly triage and test those who are coming in for severe illness, because only those need to be in the hospital, and everybody. One more point I'd like to say is people who have a cold and cough should not necessarily rush to the nearest health center, because that will lead to overcrowding and further transmission of infections. So if it's a upper respiratory infection, if it's a fever and a cough, then it's best to treat symptomatically, unless there is a history of travel, there's a history of contact, or it's a person with underlying health conditions which needs further investigations.